Hi everybody, welcome to the Kidney Coach YouTube channel. I am naturopath Fiona Chin, co-founder of Kidney Coach and Kaigenesis, a range of supplements designed for people diagnosed with chronic kidney disease. Whether you want to lower your creatinine levels or bump up your EGFR, we have supplements to support with that. I'm joined again today by one of our Kidney Coach teams and kidney extraordinaire because of her own journey. I actually would classify you, Stephanie, as a far bigger expert in kidney disease than myself because of your own personal journey. If anyone hasn't met the beautiful Stephanie before, she's gone through 2 kidney transplants herself. She has come through the other end of dialysis and kidney transplants. And then on top of that, she's also a naturopath. She's a mindset coach, yoga instructor, all things amazing with that. I stole her and basically told her she had to work with the Kidney Coach team to really help our patients who are navigating dialysis and transplant that just needed someone that got them, because I can't personally do that. And I think, and this is something that we're going to talk about, I think, a little bit today, Stephanie, but, you know, having a chronic disease myself, I often am confused sometimes by patients want to see me because I'm thinking, well, I've got a chronic disease, but they always say, but you understand it, you've been through it, you've got empathy and you're still working full time and you look healthy and all of those sort of things. And I think that's what it comes down to. Like, I see you, a vibrant, beautiful woman who has such a beautiful, positive mindset about the journey that you've gone through. And I think a lot of people could have such a victim mentality about what they've been through, 2 transplants, you know, a lot of dialysis and all those sort of things. And there is no victim in you whatsoever. You've really come out the other end and shining. So I think you're a north shining star for people that really want someone to embody through the journey of what it could look like for people and be this opportunity for transformation. So thank you for joining us and being yourself. I think you're an amazing person with everything and how you've transmuted your journey into the beautiful person and soul that you are.
I appreciate that. It's taken so much work. Okay, like getting the kidneys post dialysis for 5 years and then actually getting the transplant, as my doctors would kind of slap me on the tush, go get him, kid, you finally got your kidney. Man, was that just the start of yet another healing process? Nobody ever told me. I was like, oh, now I have all of this kind of psycho spiritual emotional healing to do because I sat in a dialysis chair for close to 6 years of my life and lost my whole 20s. And so let me tell you, this is a lifelong journey. I've tried to run away from it several times and just like completely ignore that it ever happened. It never
Yep.
works because not only do I have to maintain my kidney function, my kidney by taking immune suppression medication every single day. So I don't forget every morning and evening I have to take some pills. But also I do get a lot of calls with people who are somehow find me or come across me and say, hey, I'm new to the journey. And I'm like, hey, I remember what that was like. And let's have a conversation. So there's just no getting away from it. So it's really, how do I manage as best as possible? How do I adapt my life as best as possible, knowing that this is lingering on in the background, sometimes in the foreground, but in the background, and also continue to do all I can to kind of climb up out of what feels just like the natural kind of entropy of life as we get older. It's like sometimes we tend to slow down or not work as hard or get comfortable in our routines. Well, that's even harder when you're managing a chronic illness, to not just kind of be like, oh man, like I think this is like Stephanie 2.0 and that's all you're going to get for the rest of my life. You have to keep going.
I'm so glad you said that. It's something I've been reflecting on myself, you know, because you and I think are the same age, so let's just mid-40s. And, you know, it's the same thing. It's like I'm in the gym 5 days a week and blah, blah, blah. And, you know, people like, I was at my GP the other day running some blood tests and they laugh. They're like, where in the world is Fee? Because I'm always traveling and doing things. And I have to remind myself exactly of that because I feel like I've slowed down and I'm not doing as much. Like yesterday, gym and then physio, and then I had to go see my GP, and then the dog had the vet coming over, and then I was meant to have a piano lesson, and then I was meant to do that. I'm like, I actually physically don't have the physicality or life force energy to do that. And I'm like, did I ever do that? Is that managing a chronic disease? Is that, to your point, getting older? And then I have to remind myself that when I look around and compared to the general population is the wrong word, but when I look around what other people are doing, I'm still doing a lot more than other people. But you set up, and I think you and I are a bit similar like this, you set up this own standard for yourself. And then when you feel like you can't keep up or whatever, the story comes up, oh, it's the disease has got you, or you're falling behind, or all of those kind of things. It's like, well, hang on a minute. Life generally is meant to slow down a little bit. I'm not in my 20s and superhuman like I definitely was then. So yeah, I think that's definitely something that it's easy. Like you said, every morning you take your immunosuppressant. So there's that constant reminder that there's something wrong. And same, I have to take all the stuff that I'm on. And so there's this constant thing. And it's like, no, hang on. I'm just doing life and living life. And actually, I'm actually probably doing a really good job. And even compared to the general population, I'm doing a really good job. It's got nothing to do potentially with that, but I do have to be mindful that I look after and honour myself and start to say no. And it was really good. I cut out half the stuff yesterday because I'm like, I'm going to be a write-off if I do that and spend my whole weekend recovering. So I'm not going to do that to myself. So thank you for saying that.
Absolutely. Yeah. And it's so interesting. Listening to you talk just brought up like two other topics that I'd love to riff on in future episodes. But I think you really hit the nail on the head when you said something really important, and that's life force energy. So in terms of managing chronic illness well, it doesn't mean that you're constantly on the go. Managing chronic illness well is knowing when to take action and knowing when to slow down in the appropriate order.
100%. And it's a lesson that is taking me, I still have guilt. Like yesterday, I really gave myself a hard time. And then I actually had a nap in the afternoon. I was so tired. I'm like, woman, walking's hard for me. You've walked like between the gym and that and walking around and fixing everything, you've walked like 4 or 5 kilometers. It's way more. And the physicality of doing that, of course, is more energetically draining. And yeah, it is. It's one of those things where I'm like, I'm not going to feel guilty. This is about me. If I do this today, I can spend time with my friends and family on the weekend because I have rested appropriately when it was appropriate to rest. But that has taken me, what have I had? MS for 15 years. That's taken me 15 years to be okay with that. Like, and I'm a healthcare provider. Like, boy, like if, especially if you're a go-go A-type personality, like that whole rest picture for me, and I think you've done a much better job than me with honouring that in yourself, it's been the hardest thing for me to really honour in a way that doesn't have a whole pile of narrative that goes on in your brain behind it.
That's true. And don't give me too much credit because God had to hit me over the head with a 2x4 and literally put me in a wheelchair for a couple of years. So there's not too much more slowing down that you can do when God's like, you can't walk,
Yeah, I
So
get it.
I got some cold hard lessons, but understanding, we've talked already about how many people with chronic illness, not all, have this kind of wounded healer mentality, which is like, I want to help and fix everyone else. And I put myself last. I put
100%.
myself second compared to taking care of my husband, my child, my mother, the community. It's kind of like a natural woman thing, but I do find that a lot of people with chronic illness struggle with things like perfectionism and helping others, and just a tendency to understand that balance of giving back to ourselves. And that's a lifelong journey for me, is really understanding. I think one of my core wounds is this kind of self-love and self-worth, that I deserve to be focusing on my own health and wellness. And it's good to help the community and other people, but I was so imbalanced that literally, I would have taken myself out caring for others just because I was so hungry and empathetic for others' issues, that I became imbalanced. So yeah.
No,
All right. So
yeah.
yeah. So this kind of leads into, both of us have some experience with chronic illness a little bit differently, autoimmune issues. I have the kidney issues, dialysis, transplant. And because I had a lot of misdiagnosis from the start, things have changed a lot since my first diagnosis, which was 18 years ago. We've had some innovations and some changes in how we diagnose, but I had mentioned in past podcasts that I went through about a year and a half of misdiagnosis and had seen maybe like 6 or 7 doctors. And it was becoming ridiculous, sadly, because often they didn't want to say, I don't know what's wrong with you. So they would kind of say, well, I think you've got osteoarthritis, or maybe it's this, or I think you have this, or maybe it's just your anxiety or your hormones. Like it's just, I was never happy with what I was getting. So I started to do my own scientific experiment on myself very early on. And I think a lot of patients go through this where all of a sudden you go from being a patient to people ask you, are you a doctor? Because all of a sudden you are so incredibly informed because you have to be. You have to be armed with the information. And that's one facet of your community that I love. The people that I speak to, very different than the aggregate of a lot of the other populations because your community is so well informed and proactive. So it's such a delight to talk to people who come through Kidney Coach because they're their own investigators and they're not going to give up and they're not going to just settle if they're not happy with what the doctor says. And the longer I go into managing my illness, the more and more I realize, oh my goodness, my story may have been different if all of these other facets were addressed. So tonight, because you're so good at this, I just thought for the patients or providers or anybody watching, let's give this kind of, 50,000-foot view on 5 really important things that have come to light more recently in the medical world, especially the functional naturopathic world, that need to actually be integrated into the medical world, that need to be addressed, as well as, just diagnosing, labeling, blood work, etc. So I'm going to ask you some questions tonight.
So yeah, Stephanie surprised me with this before we hit record, and I said to her, "Lucky I've been training doctors the last 2 weeks, so I'm like, this is literally the conversation I've been having over and over again. So we should be okay to go."
Okay. Okay. So this is a little personal, because I'm also continuing to try to heal myself in asking these questions, but I think it's very relatable to many, many people. One of the hugest things that I've discovered was way overlooked and contributed to my autoimmunity, relates around the first question. So we're going to talk about the gut kidney axis and the microbiome. Okay. So emerging research highlights this gut kidney axis where gut dysbiosis may drive inflammation and worsen or contribute to autoimmune or CKD progression. So, what innovative microbiome targeted therapies or dietary protocols are you exploring to help support patients with kidney function or autoimmunity? And what challenges do you see in integrating these into mainstream culture?
Great question. Yeah, so the microbiome really, it's funny, as a naturopath, the first thing we got taught in uni, this is I'm like 25 years ago, is that all disease starts in the gut. Now, you and I would probably say it starts further out than that with mental and mindset and spiritual, but if we just look at physicality, a lot of disease does start in the gut from the microbiome. So what we do know about the microbiome is that the microbes in there produce things called short-chain fatty acids, which are really important for perpetuating then continual healthy gut flora. You want good amounts of butyrate, which is protective to the brain. You don't want something called a leaky gut because your brain seems to mimic that. And I suspect there's also when you get a breach in what we call the microbiome, or the, sorry, not the microbiome, that the gut type gap junctions, they're probably then what happens is, if you imagine your gut lining that should look like that. And then if you have a lot of antibiotics, a lot of sugar, processed foods, certain medications, stress, too much coffee. It's why we do talk about coffee being potentially an issue in kidney disease, or one of the reasons. The standard Western diet, which is high in hydrogenated fats and things like that, you end up punching holes in this beautiful gut lining that should look like that. So it ends up looking like this. So then what happens is you are getting undigested food particles or proteins passing into the bloodstream too early. Now, from an autoimmune point of view, that puts extra pressure on the immune system because you've now got protein complexes floating around the bloodstream that shouldn't have got through these tight gap junctions, meaning your immune system goes, well, that shouldn't be there. Hence, we start to get allergies to things like gluten and glyphosate and to dairy. And so then you start to produce more inflammation. And then that is the background cascade for potentially things like autoimmune disease like lupus and MS and things like that. They've now proven in things like MS particularly and Parkinson's that there are specific under or overgrowths of certain microbes in the gut that can contribute to autoimmune diseases. So that's the immune part. On the kidney side, again, if you think about immune complexes and proteins passing through the bloodstream too early, what do the kidneys do? They filter the blood. So if you've got these broken or not broken down proper food particles coming through that have then got cytokines and inflammatory markers attached to them, the kidneys are filtering that. And the kidneys take up 10% of oxygen in our body every day, meaning they're very metabolically active. And they're filtering the blood, I can't remember the thing, I think it's like 40 times a day or something like that. I may have made that figure up, I should remember, but it's filtering the blood on over again. So if you're eating things that are punching holes in your gut and they're not being broken down properly, they're going through, we already know the kidneys don't really love when their functions start to change a lot of protein, because protein for kidneys is like punching holes in the kidney tissue. So you then get an increase in things called uremic toxins. Uremic toxins then have to get filtered through the kidneys. You get this increase in something called BUN. So if you're looking at your blood test and your BUN levels are up, that generally is a sign to me that leaky gut in the gut is causing a spillover effect into the kidneys, and the kidneys are then working overtime to filter these proteins. And these protein amino acid chains are probably going to be due to leaky gut. Then we also know that in kidney disease, certain strains of probiotics do seem to make a difference. And so there's that as well. So this whole gout, increased uric acid levels, BUN, all very, very related to the microbiome in the gut. And so you asked about dietary strategies. The most basic things are to take out the highly inflammatory foods that we do for autoimmune disease: too much dairy, sugar, processed oils and seed oils and things like that. Dairy, I find most people struggle with. So they're the basics. And then the kidney-specific diet is an alkalizing one to take the load off the kidneys, because the kidneys spend most of their time just trying to keep our blood levels and our pH right. So I think diet can never be overstated, and so many people might say, well, I've taken your products and maybe it's not working the way I want it to. And I always say, have you changed your diet? Because there is no magic cure. You have to do everything. The people that get really well on our program are the ones that do everything. And so the gut really, really is important when it comes to healing kidneys. So that's the basic, not too deep dive on that. So yes, microbiome, very, very important. Did that answer that well enough for you?
It did. I have some naive questions.
Far away.
Is there a specific test to test the leakiness of the gut lining?
There is zonulin. So when the tight gut junctions become open, you'll get an increase in a protein called zonulin. Zonulin also will show that there's a gluten issue, but zonulin basically, if you've got too much zonulin, these tight gut junctions are open. You can also do a stool test to see what your levels of butyrate and things like that, and short chain fatty acids. But zonulin is the fairly specific test that we look at for leaky gut syndrome, especially gluten-derived leaky gut syndrome. Gluten seems to be the thing that will open up the tight gut junctions, or at least there's the most research in that, and then it will increase zonulin levels. So yes, you can generally do like a GI 360 from doctor's data is often what I'm doing, and then you tack on things like zonulin to have a look at what that those levels are like. So yeah, we can definitely test leaky gut.
Wow. Okay. Nobody's ever mentioned that to me before
Of course.
in all of this time. And I had substantial gut issues. And even post transplant, some of my medications affect my digestion. So I'm always mindful of trying to take probiotics, watching my diet. I always seem to be starving for omegas, the right omega. Very interesting. Thank you so much. And I definitely would suggest anybody watching this to reach out to you guys if you have any of these issues, because my doctor has never mentioned this inflammatory process that could be going on within me. I know not everybody has it, but almost everybody that I know actually does have it.
Especially when there's especially when there's an autoimmune component to it. You can almost guarantee gut links. So yeah.
Right. Okay, so that's a huge one. Okay, next question is going to be around environmental toxins and autoimmunity and CKD. So, given the rising concern about environmental toxins like heavy metals and microplastics contributing to chronic illness, what specific or any detox strategies or diagnostic tools do you find promising for CKD patients? And how do you think conventional medicine may be overlooking these exposures?
I think, to answer that last question first, I think because it doesn't fit in the conventional model, because there's no drugs that you can give for it. And I know I sound a bit pessimistic here, but you've got to understand that standard Western medical care, unless your doctors or practitioners have gone out and done extra training, are very much disease process, drug intervention. That's just the training. It's not a dig at anyone. That is just how they're taught. That's the system. So unless they've done functional training on top of that to look at what we would call the drivers and the causes of things like that, which you and I know that things like glyphosate and things like microplastics, especially in kidney disease, cadmium, aluminium seem to be the big, and lead seem to be the big three heavy metals that will increase kidney disease. We know certain dye contrasts will increase kidney disease. We definitely know medications like lithium. I mean, the amount of patients that I have with lithium-induced kidney disease, because once they got, and it's in the diagnostic criteria that if you've got bipolar and you're on lithium, you should be checking kidney function, because it's well known as a nephrotoxic, every 6 months. But what often happens is providers get the lithium levels correct and then they never check. And then 15 years down the track, you've got a patient that's been on lithium for 15 years and no one's checked their kidney function, and they're at end stage kidney failure. The amount of times that I have seen that is soul destroying, and it could have been avoided if doctors were doing the intervention that they should be doing. So there's that. So yeah, heavy metals, lead, cadmium, and aluminium seem to be the really big ones. Cadmium is a lot in exhaust fumes, smoking, aluminium in paints, using a lot of airfoil cooking pans and things like that. Lead, obviously lead paints and some of the old piping. And then, yeah, microplastics are everywhere. You know, if you're going out and you're getting your takeaway coffee with a black lid on top and you've got the steam coming up, that heats that black lid and it drops back plastics into your daily coffee. Even if you're having a tea with the same thing, anything with those black lids, those black takeaway containers, black seems to be worse. If you're storing things in plastic takeaway containers or buying and then heating in the microwave, microplastics, they're kind of scary, microplastics, they're everywhere. You've got to think, again, your kidneys are filtering. So any of these extra environmental toxins, your kidneys are going to have to filter. And glyphosate, which is a spray used, it's interesting, I had this conversation, I was just in the other side of Australia doing INUSpheresis, which I'll talk about in a sec, because it's how you take stuff out. And WA, which is the western part of Australia, patients have, and because I'm testing this in patients all the time, really high glyphosate levels because it's a farming country. We had another practitioner reached out to me yesterday saying she's got a patient in WA diagnosed with Parkinson's, and they did a test, so you can test for all of this, urine tests. I think urine is how they're mostly doing it, and this patient had very high glyphosate levels. And she's on farming country, so they're like, how do we get them out? So yeah, there are different detox things that we can do. We can look at using things like Pectosol. It's one of my favorite gentle ways of doing that. Basic charcoal, and then dietary interventions, and just making sure you're very conscious about the products you're putting on your skin, and not using takeaway plastics and things like that. But then if you want radical interventions, and you know me, I try anything before giving it to my patients. So I went over and had this INUSpheresis, and they basically take out 25%, or they take out 75% of your plasma, which contains plastics, glyphosates, immune complexes, and they filter it all out. And they do that over 2 days. So I've just gone through that process because I've got so many patients that we think need that. So I always go and try it on myself, so I know how to explain it to people. So there are some really cool interventions coming through, but they're expensive and not everybody can afford to do that. So then we've got cheaper options like dietary interventions, using things like binders, like Pectosol, probably my favourite one to use because it's got the most research in it, and then basic dietary interventions, and then lifestyle modification to reduce your exposure to things like that.
Wow. Okay, two things. First thing is, are you saying plasmapheresis?
No, INUSpheresis. So it's different. INUSpheresis. EIS, something like INUSpheresis. It's a fairly new procedure. So apheresis is the most well-known one. That's where they take out all of your plasma and replace it with albumin. I think kidney disease will be aware of the word albumin because it's something that we often test for. INUSpheresis is gentler. You do have to do 2 sessions back to back. So what happens is they take out 75% of the plasma. They pump it through what looks like a sort of big dialysis machine. So I had a needle coming out one arm that was taking the blood out. I'd watch the blood go through the machine, and then it would extract the plasma, cleaning the plasma. It would return 25% back to me, and then it would take out the rest. I'd then have 24 hours to recover, and in that 24 hours, my body produces more albumin to bump up the plasma levels, but it pumps out toxins from deep inside the cells from doing that. And so then you become almost more toxic in those 24 hours, and then you go back onto the machine the second time, and then you're filtering out what we call the intracellular toxic dump. So again, 75% of your plasma comes out and filters, and then 25% that's filtered comes back in. And then you spend the sort of week after that. And I have definitely felt more fatigued, but everyone's been, and I noticed that my skin looks different. I'm like, oh. So yeah, I'm again too early to tell what it's done for me. And we've sent off all my plasma for testing to see what was in it, like what microplastics, glyphosates, all of those sort of things. So you can extract the plasma and then test it. There's only about 8 or 9 clinics in the world. It's used a lot in Europe. So it's almost a standard clinic practice for autoimmune diseases, for long haul COVID, long haul vax, Lyme disease. It's used very popular in Europe. I think there's 1 or 2 clinics in the US maybe doing it, and luckily Australia has a clinic, Abu Dhabi has a clinic, but and I'd recommend anyone thinking about having stem cells to go and have something like INUSpheresis done first, because the stem cells seem to stick better when you clean the blood first, because then the stem cells aren't going away and cleaning up all this other sort of stuff. People are looking at really advanced protocols.
I'm very interested. I actually had plasmapheresis twice. So it was my understanding at the time that they were removing all of my plasma to primarily get the antibodies out. So I would have a better.
You have donor plasma, right? And then you have someone else's plasma go in.
Right. Yes, I had that. And that was a very common therapeutic for people that had high, I forget what it's called, not PCR, PRA.
Yep.
The, what is that called? Protein reactive antibodies against the organ. So
Yep.
I had that done twice, but for some reason, they've stopped it. And fortunately for me, it worked fairly well for me because I'm going on over 10 years with my second transplant with no issues. But there's a narrative with a lot of my friends who are either second transplant recipients waiting for their second, or they have high antibodies for whatever reason, pregnancy, blood transfusions, multiple transplants. The therapy used to be, let's do the plasmapheresis and some IVIG to try to dampen down those T cells and those reactive antibodies, so we have a better chance with your kidney succeeding. I noticed over the last year that all of a sudden my friends with the high PRAs are getting denied this. And they're saying that you're going to have a rebound effect no matter what. That's the running narrative that I'm hearing. Oh, they're telling me I'm going to have a rebound effect. They're telling me I'm going to have a rebound effect, so they won't do it. And I'm saying, well, okay, but I've had it done twice and I think it worked for me and I'm not having a rebound effect. So why all of a sudden will nobody do it? I'm very curious.
What do you think? It's been the last couple of years. What's happened since then?
Yeah.
COVID vaccine spike protein, it's in the plasma. You go put it back in someone with an immune reaction, you're going to bump their immune stuff up even more. So we need unvaccinated people to donate plasma.
There it is, folks, right there.
People are going to think I'm tinfoil hat, but that's exactly what's happening. So
Yes.
they know that. So there's not a big dialogue about it, because we know that there's spike proteins in vaccinated people. You're going to put it back in and you've got autoimmune disease. So that's why things like INUSpheresis and things have taken off, because you're not exchanging it with donor plasma. They still do it in Australia. They're donating plasma, but they had put a call out for people that were unvaccinated to be donating plasma. But I think that's been part of the issue that we're seeing is people that were donating had huge amounts of spike protein, and that was causing other issues, so they reduced it. But that's where the INUSpheresis is good, because you're not putting anyone else's plasma back in, you're just leaving 25%, so you're not completely depleting the person, and then you have to pump out your own. The other thing that you can do, and it's Apheresis, is that they will just put in blank albumin, so it's not someone else's donated. So that is that's what they do in Japan. I think they do it in the US as well.
I wonder if that would be an alternative to plasmapheresis with donor plasma.
It absolutely would be, because it's just blanked albumin. It's not, from my understanding, it's not donated. I don't know if they synthesize it. I'm speaking out of terms. I don't know exactly how they do that, but that's just straight albumin going in. It's blank. It's got nothing in it. It just replaces what was taken out versus having to have donor. But my understanding from the grapevine and talking to people that are in the industry, and I haven't made that up, that's coming from people and that I've spoken to about this, is the reason they're not doing so much of the full-on what they call plasma exchange is because of the spike protein issues.
Yeah, well, that makes total sense. And I've thought about this as a patient. Blood transfusions, blood and plasma. I've thought about that, and I've thought, well, it looks like we're going to have to get alternative banks of blood, and I know that they're already doing that in America. I know they have some blood banks with non-vaccinated blood. I don't know about plasma, but I'd be interested in looking into it.
Yeah, I know in Australia I saw somewhere they were asking for people that were non-vaccinated to donate plasma, but I still know they're doing plasma exchange, and then the IV, GRB stuff as well. But yeah, that's my understanding of why that's dropped off, because of potential, especially if you've had a transplant and you're on immune suppressants and things like that. So yeah.
It's leaving a big conundrum. I have quite a few friends who are waiting for their second transplant, and it's left them virtually helpless, because now it's like they don't know what to do, because they're not able to get the therapies that they need. I think there's a drug coming to market that's showing promise with reducing the antibodies, but I have a couple of friends who are really struggling because of the situation right now. So it's difficult.
Interesting. I think there's a couple of clinics in maybe Florida that do apheresis, or it might be INUSpheresis. If you Google INUSpheresis clinics, they'll come up. Like I say, most of them in Europe. There was the one in Australia. I'm trying to remember if I even saw one in the US, but definitely apheresis where they're putting albumin in. I do know they're doing.
Can you spell the first half of that word?
The INUSpheresis or the apheresis?
Either or.
INUS PHER INUSpheresis. INUSpheresis. I'll put it in the show notes.
Okay. Thank you. That'd be great. Yes. Very, very interesting. That was a great question. I learned a lot from you there. Thank you so much. Yeah, I mean, I've wondered a lot, like, there's other theories that go around, and there's a lot of talk around cloud seeding, and is there anything going on there? And what about parasites? And we all have parasites, and now we need to do parasite cleanses. That's a huge thing in America. And before we go on to the next question, is there anything that you can say about parasites? I know a couple of people who work for companies that do really great parasite cleanses, but one of the contraindications right on the bottle says, do not take if you have an organ transplant. So can you explain that?
Yeah, so there's a big thing at the moment using a combination of ivermectin and fenbazimol. I think I'm saying that correctly. Something. It's Parapurge make it, and they're using it for cancer. You've probably seen that everywhere, and it's that combination. For some people seems to be very, very effective at stopping cancer in its tracks. It's not something that I have experience with. I don't work a lot in oncology. I do know there's a theory in specifically multiple sclerosis that it is a parasite issue with parasites in the cerebrospinal fluid in the spinal cord. And, they did all these autopsies and found that every single person with MS had parasites in the spinal cord tissue. And I have been down that rabbit hole for MS. I've done the hardcore parasitic cleanse, and again, it comes back to, I think we have to be very careful about not saying parasites cause disease in everybody, as I know some people do say with MS. because we know that, like, I had so many head traumas as a kid riding horses, and I had a big head trauma right before my MS came on, and then I had the riding accident, with which instantly I had no spinal cord lesions and then had heaps. So we do know trauma will drive it. So in my case, I don't believe it's parasites. I believe it's trauma driven. And I did the parasite cleanse pretty prolifically and to the T, as I always do, and I just lost too much weight on doing all of that sort of stuff. So I think we have to be very careful about lumping in things everywhere. That being said, I fall in two camps. It's a bit like the germ theory too, right? You know, when we stopped our kids playing in the dirt and we suddenly asthma and allergies and everything, you know, went through the roof. We are meant to have some parasitic exposure. I mean, you look at people in India swimming in the Ganges and they're not getting more MS or autoimmune diseases. So we can't go and say that parasites are causing everything. I think it comes back to your original question, is it an imbalance in the microbiome and the gut? Because that's what then allows things to overgrow in the gut, because the microbiome should be regulating that sort of stuff. And maybe that's why we've had an increase in parasites, and that we've got immune systems that have been bombed by microplastics and all the other stuff that you spoke about. So it kind of just goes in all those orders. So our immune systems aren't as good at clearing or staying on top of things like parasites. So I'm not on the big parasite bandwagon, but I do with patients when we do, like I do a lot of microbiome testing, and I can't say that in every patient that I'm microbiome testing, and I'm doing the one where they're cultivating eggs, they're growing it, they're leaving it for 3 days to see if something grows. It would be 1 in 100 people that a parasite will come back. Mm-hmm. And again, it's not like I'm not doing the big expensive screening tests and looking for it. I tell you what I do find in a lot of people, candida overgrowths from too much sugar and things like that, and doing a candida cleanse. And candida, interestingly, seems to thrive where people have heavy metals, because candida seems to offset. It's one of the things that tries to offset the imbalance of heavy metals. So again, you have to be very careful about doing too much anti-candida work if you're not supporting detox and using things like pectosol and binders. So, you know, everything comes, you know, in a seesaw. So that being said, I have had a couple of MS patients where, you know, they've got weird fungal rashes and things like that, and I go, these people, it's definitely been driven by parasites, and we've done the parasite protocol and they have gotten better. And on MRIs, their lesions are disappearing. So I'm not saying it's not everybody. There is a percentage of people with autoimmune disease and kidney disease, there will be parasitic stuff. Again, I'm really big about not blanketing it that it's everybody. But that doesn't sell programs when it's not for everybody. So I don't believe all autoimmune diseases have it. I believe the best thing we can do is test, and from symptom picture, you know, if you've got elevated eosinophils on your blood tests, that's a good sign that there probably is, that's your immune system acting to parasites. I had a patient the other day with elevated eosinophils who's got long haul COVID. And so we are doing a parasite cleanse on her. Her gut microbiome came back with the parasite, and she's had the long-term eosinophils. I had another patient diagnosed with muscle dystrophy. And she was diagnosed with muscle dystrophy. She's one of the craziest stories of patients, of everything you're talking about talk about self-advocating. Muscle dystrophy, I'd known her for a long time through the Dr. Joe work. She was in a wheelchair, and the last time I saw her before she reached out to me, she'd lost her voice and her breathing pathways were starting to come down. And she's like, this muscle dystrophy is going to kill me. And she had this weird marker on her blood test. She had elevated CK levels and she had elevated eosinophils. And then she did some digging. She exactly became her own doctor. She's a naturopath as well, non-practicing for a long time. And she saw that there is a parasite in Australia and I think in the US that will mimic muscle dystrophy because it gets into the muscles. So she had these markers. She went to 3 doctors. They wouldn't give her the antiparasitics. She found one that did. And within 3 weeks, and she had wasted away. She was like 35 kilos. She put on 10 kilos in a really short amount of time. And now her and I are working together using advanced biohacking stuff and peptides to regenerate muscles. And she's doing amazingly. Like, we're trying to get her out of the wheelchair, and even to talk to her, her voice has started to come back. And she's amazing, and she saved herself because she became her own advocate and did everything that we're talking about. And I don't know what would have happened to her if she didn't do that. And hers is definitely parasites. So there are definitely some cases we have to look at it. And I think that's another really cheap marker that, you know, every blood test that people are looking at is these eosinophils. They will go up if you've got a parasite active somewhere. So you can test that one. And then if you, again, weird gut stuff, chronically low iron for no other reasons, potentially you're looking at microbleeding in the gut from parasites, doing parasite cleanses can be handy there.
Wow, that's amazing information. One quick question before the next question is mold. The Candida, I'm seeing a lot of people all of a sudden getting diagnosed with mold. And interestingly enough, when I used to see an acupuncturist when I lived back east, my acupuncturist would say, "You're damp. You got dampness." Right. So, and I'm kind of putting two and two together here and kind of seeing this constitution that can happen and what my body would prefer. But can you talk a little bit about mold?
Yeah, thank you for bringing that up. We should have mentioned that in the environmental toxins. Yeah, mold is a big issue, mycotoxins. There is a certain genetic subset that seem to be very sensitive to mold. There's something with the HLA genes because some people can be exposed to mold and have no issues, and then other people get what we call CIRS, chronic inflammatory reactive syndrome, and then MAX and all sorts of things that can come off the back of mycotoxin exposure because the body can't clear it, and it is this genetic predisposition. If you know anything about the Schumacher protocol, there are some tests that you can do to see if people are going to have like biotoxin illness and mold illness. And mold, you know, and I don't know what it's like in the States, but mold in Australia, like if you're renting a property that has black mold in it, they know how bad it is. It has to be remunerated and cleaned up by the landlords because they know that black mold is super toxic. I had an MS patient actually where I'm like, you just get a gut. I'm like, I think yours has been mold driven. I'm like, you're mold. He's like, I can't see any. And I'm like, go just pull the wardrobes out and check behind the doors and things like that because, you know, I've had other patients like, there's no mold. And then they go to move house because I'm like, there's something, it started when you moved in this house. And then they'll pull the wardrobe out and behind the wardrobe, they'll be full of it. And then they suddenly realise. But yeah, mold is a big one, and the way that it works is it increases in this certain subset of patients, it increases inflammatory cytokines, and then you get these mycotoxins. They will cross the blood-brain barrier. So you get a really random set of symptoms generally. It can definitely drive autoimmunity, but you'll get like brain fog, you can have full-on personality changes, you can have almost like a bipolar type of personality, mania and quite severe depression. And then lots of inflammation, like weird joint pain, weird rashes, and then irritable bowel, digestive changes, brain fog. You get this big mishmash of sort of symptoms that don't seem to sit anything in any category, and people get diagnosed with chronic fatigue or fibromyalgia. But yeah, quite often be mold, and that one you can test for, urine tests and things like that. You can check for all of the exposures to those sort of things as well. So yeah, I've got quite a few patients, and at the moment where it's mold, and again, they'll get these. I've got a patient again, I'm thinking she's an MS patient, but she's got these weird, it looks like fungal spots on her body. So I'm like, we need to check you for mold. So we're in the middle of doing a mold protocol. She was one of the reasons I went and had the INUSpheresis in Perth, was to just check it out for her. So yes, very good question, Stephanie. Mold, and I would say people in warm, damp, humid climates, where the houses aren't drying out properly, if the house hasn't been sealed up properly, if you've had any black mold, often they'll say their children, their personalities change and things like that, or the children start wetting the bed. It's a really common one in kids. Out of, they've been dry and there might be 6 or 7 and suddenly there's bedwetting starting. That can often all be mold. So it's a huge problem. I've got another patient, a Parkinson's patient at the moment, and they just had so much mold that they've been moved out for a year now while they're fully gutting and renovating and fixing the house and having to re-stump it. And since moving out, fancy, his symptoms have gotten better. So, yeah.
Sadly, in America, we don't hold landlords responsible for proper remediation. It's just kind of, yeah, so it's a bit tricky. But yeah, I'm seeing that a lot, and I find it so fascinating how dove into this a bit too, and the literal anxiety, depression, mental health issues that can be really associated with things like these fungal molds and fungus and certain viruses. And it's just so fascinating to me. I'm thinking, oh my gosh, all this chronic depression and anxiety that we're just plagued with. Is it because we have something else going on,
Yeah, no, absolutely. Mold is definitely getting the attention that I think it deserves. And it definitely seems to have gotten worse. And, it wasn't something we spoke a lot about when I went through uni, 20 years ago. And it is now. So I don't know whether, again, that's because our microbiomes have gotten worse, whether we're just more switched on and we're more savvy to that, or whether because of increased native EMR and electromagnetic radiation and all these sort of things, whether all of that sort of grows together and our immune systems are floundering a little bit. I don't know why, if it's just a symptom of awareness or whether mold has gotten a bigger deal and our immune systems are more suppressed with all the other toxin stuff that we spoke about in guts, that's why it's a bigger issue. I don't know if it's chicken or egg, I'm not sure, but definitely it's one in any chronic autoimmune disease and things like kidney disease that should be investigated.
Yeah, thank you so much. I mean, not only when I was asking my traditional Western medical doc some of these alternative things, I mean, it's very easy for them just to simply write it off and say, oh, no, that's not it. Like, that's not going to cause it. Like, there's just such a diminishment. And I think one thing that's just more evident than ever is that it is a big deal to some people. Like, some people are very sensitive to this stuff and you really care about your patients. You might have certain patients who are, steel gut lining or whatever, and mold doesn't affect them. But you got to admit, what we're doing traditionally isn't really working that well. And there are people who just tend to be very sensitive to certain things. They're just hypersensitive.
Absolutely, yeah, and we know if you've got those HLA genes, you're going to be more sensitive to mold. That's a proven thing. So yeah.
Yeah. All right. Next question. Personalized nutrition and metabolomics. Functional medicine often emphasizes these individualized approaches, which I love. Are there cutting edge metabolomic or genetic testing methods that you're using to tailor nutrition or supplementation for CKD patients? And any gaps in the conventional dietary guidelines that keep you up at night?
The whole food pyramid keeps me up at night. it's all, yeah, like where do I start with that? Yeah, I think to your point and sort of what we're talking about is there's no blanket one cure fixes all. Like, I think that whole thing just has to be completely thrown out the window. It just doesn't work that way. So in any patient that I'm working with, and I'm really lucky, I'm working with a big subset of patients and I've been doing a lot of work in I guess you'd call it the biohacking field, but people that really want testing. And so I'm running a lot of things like, I guess what we're doing is we're doing full-on gut microbiome testing, genetics. So we test the whole genetic methylation process. We then check something called a Nutristat test here in Australia. That one will check for, I'm checking organic acids and I'm checking amino acid profiles, heavy metals, hormones, the lot. It gives me all of those tests. Plus then I'm running a lot of true age stuff. So I'm looking at telomere lengths and methylation expression on certain genes and things like that. So I find that whole thing really, really interesting. And when you get all of that information, being able to then specifically target and treat a person is so much easier because guesswork's taken out of it. So I'm a big on not guessing. I would say I'm a pretty intuitive person and often get a feel about what we should look at. But if patients can afford it, I always like to run in-depth testing because then it means I don't have to use as many supplements. I know exactly how to do the diet, especially when I've got full gene profiles. If I know if someone's an APOE4 carnivore and really high fat diets are not going to work for them. If they're an APOE2, that might work better. An APO3, we can work somewhere in the middle. If we've got methylation genes, we know not to give them unactivated folate. We know that they're going to have a harder time with things like glyphosate and all those sort of things. So I like taking the guesswork out. I also understand a lot of that testing is expensive. I am very lucky in Australia that I have a network of amazing doctors around me that I can refer patients to, and that anything that can be tested through insurance or through Medicare, which is the system in Australia, which means patients don't have to pay. So say I have a patient coming in that says, look, I just can't afford to do all those tests are, 2,000 Australian dollars. Not everybody can afford to do that. So I have an amazing doctor. He takes the blood and then we can look at, a really good questionnaire. If you're a really good healthcare practitioner, you know what questions to ask. And then basic blood panels like looking for things like increased eosinophils. that'll give me a clue. Like, is there inflammatory markers up? Is there RDW, which most people don't look at, which is red cell definition and change? I mean, that's going to tell me there might be some stem cell exhaustion. And then from a really good picture, because of 25 years of practice and talking to people all the time, you get a good idea. So there are ways around it. My preference is always to do all of this testing that you're talking about, because I think it saves people time and money in the long run. And it means that when I am then prescribing, I don't have to give them 50 million things. It's targeted. And I know that if I can unbottle jam or, improve this part, it'll flow down to the rest of it. So I know, because I've got an old patient of mine that I haven't seen. They were seeing someone else because I tried to retire there for a while, and they just emailed me and they're like, we're seeing a new practitioner. My son's on 50 products and we can't afford it. And I'm like, he just doesn't need to be on that much. So yeah, I'll help him again. So yeah, I think testing definitely has its place. It's really great. It takes out guesswork. There's so much different testing that you can do. I have my standard ones that I stick to. And then if you can't do that because of cost, having a really good doctor and being a really good practitioner and knowing what questions to ask and getting it out of the questionnaire, and then basic testing will still give you enough information that you don't have to have people on 50 million supplements, especially in kidney disease, because kidneys have to filter it, right?
Man, this is so enlightening, and I'm so grateful for all this information. And again, as a patient who's been through this, I'm still sitting here thinking, I don't know the answers to half of those tests in my own body. No, no, and it just seems to me like, isn't this a no-brainer that these should be upstream, not not like, I've tried everything and now I'm in a really desperate situation and now I need to come to you and figure out my gene expression or like what's going these other tests. Like, it just seems like, I'm glad that it's there, but it seems like it's being used more as a cleanup because other things aren't working and things have gotten disparate, rather than, hey, let's figure out who you are from the start and try to do better with prevention.
Imagine if, every 18-year-old, let's just say, because 18 is a consensual sort of age, had their genetics tested and they had a roadmap to say, going forward, you're going to have issues with this, this, and this. I will say they did do studies to say that if you go out and say, look, your APOE4, which is the Alzheimer's gene, you go out and say, look, you've got APO4, you're far more likely to get Alzheimer's. You actually can do the nocebo effect, and you can say that. So I think, number one, you have to be a very good practitioner in the way you word it with people. I'm very mindful with genetics about how I relay information to people, especially people that are looking for something to be wrong with them. So I'm just like, this information is just to help you going forward. Doesn't mean that you've got anything. We're looking at SNPs, it's epigenetic expression. It doesn't mean that you'll go and get it. Lifestyle, genes load the gun, lifestyle pulls the trigger. It's the saying that everyone says, and I truly believe that. But I think having that information when it's used properly and not used to scare people and sell products is really, really empowering going forward. Out of patients, I can say to them, look, you've got the gene that doesn't process alcohol. But alcohol probably is going to be an issue for you, and you've got the lactose gene, and you've got this going on, the MTHFR gene that's got a lot of energy behind it, or, popularity. Yeah. It's like, you've got this information, you need to look out this way. So I find all of that stuff super empowering for people. But, I'm not prescribing off genetic tests. I prescribe off the Nutristat, which tells me exactly what the body's doing. It tells me what hormones are out, what the mitochondria are doing, tells me if they've got heavy metals, gives me a bit of an idea about gut, cholesterol, red cells. I always prescribe off what is happening, not what potentially could go wrong.
This just highlights yet again the need for people who hold power, providers, help, whoever it may be, to be wielding it as appropriately as possible. I mean, we talk about this a lot with tech, is like, oh, who's wielding this tech? Like, is this going to take us into a dark area? Could be. But it's the same with this genetic testing. And when you come to this powerful information, the person wielding it has to do it the right way, like you said, not to sell or manipulate or make somebody fearful. So it's just as we move forward, it's just, we all have to continue to make sure we're wielding the information properly.
Yeah, nothing gets my goat more. My business partner will tell you this, that I won't, there's a particular person that bangs on about the MTHFR gene, and if you've got it, this, and that. And I'm like, 75% of the population have one mutation on the MTHFR gene. It does not mean, some people, their homocysteine levels are, super low and they've got double mutations. It's just that gene's not expressing because for whatever reason they might not have had trauma, or everything's right, or they might not have had exposure. So why would we go and tell them that there's something wrong with them when there's not? So, but it's all clickbaity, right? So
Right.
I'm really big on all of that, especially the APOE4, because that one will scare the crappers out of people. If you're like saying, you're probably going to get Alzheimer's, I'm not going to do, why would I give, as you would know, a chronic health diagnosis is one of the most stressful things that you can go through. So why would you prepare someone's adrenals and cortisol by saying, look, you're probably likely to end up with Alzheimer's? That's not true. We are beginning to see people reversing Alzheimer's, and that it's completely preventable with lifestyle and some other sort of interventions. So I'm more likely just to set them up for success versus saying you're going to end up with a disease. And if you don't do everything I say and see me every week and pay me lots of money, then you're going to be in trouble. Like, that just doesn't bode well with me personally.
Yeah. And, I love the idea too of, let's not keep patients in the dark and be driven by naivety and just like not knowing, So I think the whole field at large, in the West, especially, we need to all mature a little bit, I believe, to be able to contain the complexities without giving over our autonomy and feeling fearful and letting the provider kind of drive the bus solely. So it's a process. I think it's happening for a lot of patients. I think since 2020, a lot of patients have realized that they need to take their health into their own hands more and be more responsible. So that's positive. But there's a lot of nuance there that could be, to get a little tricky. So let's move on to the next question, so I don't talk to you all night. All right. So the next one is about immune modulation and chronic inflammation. So chronic inflammation is a hallmark of CKD and most chronic illnesses, I would say. Beyond standard anti-inflammatory diets, what novel therapies or supplements or immunomodulators are you invested in talking about, and what barriers exist in validating these for broader use?
Great question. I think it always comes down to drivers, right? Like, what is driving inflammation in a person? Because it's, if we just go in and say, right, everyone needs to be on fish oil, highly anti-inflammatory, love fish oil. In fact, probably most people should be on a quality fish oil if they're not eating it and getting good quality in their diet. Or plasmogens. Turmeric's a fabulous anti-inflammatory with lots of information and studies behind it. And then of course we've got diets like that take out of the seed oils and sugar being highly inflammatory, and Western diets inflammatory in general. Those things we all know work. But when it comes to knowing why someone has inflammation, it's the same with CKD, right? The cause. So is it, back to your point, is it driven by mycotoxins, mold exposure? Is it just a dietary thing? Is it driven by an essential fatty acid deficiency? Is it driven by gut microbiome producing a whole pile of gut toxins? Like, what is it? Because if you know what's driving the inflammation, then you treat the cause. And you're not just, because natural medicines, while they might have less side effects, still, if you just go and give someone with a lot of inflammation turmeric and fish oil, potentially you're still just band-aiding things because you haven't removed what's caused the toxins or the inflammation in the first place. So I guess my first part is, and I love your questions because they're staggered in such a way that you've sort of walked us through exactly how you should be thinking as a healthcare provider. So, inflammation is going to be downstream from something else. So what is causing it? Again, like I said, gut, environment, diet, and you want to remove that. Give that a bit of a go first. So, because my analogy that I always use is that if you're going to give someone a whole pile of anti-inflammatories, say like fish oil, krill oil, whatever it is, and you don't treat the cause, it's like driving with your foot on the accelerator and brake at the same time. But if you can remove the driver, you're taking your foot at least off the accelerator, and then those nutraceuticals have a much better chance of actually working in the body because you've taken out the driver. So I think as healthcare practitioners, we have to be really mindful of treating the person, not the disease, cause not effect, and making sure that whatever we are supplementing or giving to people, that we are looking at the underlying cause so that people don't have to be on supplements for the rest of our lives, because as healthcare providers, we have missed the point if people have to be on these supplements forever, because we haven't looked at addressing what actually is causing or driving it in the first place.
It's such a common remark I get from so many patients I talk to, including myself, was there's not, I'll say to people, well, what was your underlying condition that caused your CKD or your autoimmune disease? I don't know. They didn't tell me.
Yeah.
And I hear this so often. And in fact, with my autoimmune disease, at the time, it was probably just a mishmash of environmental factors. And at some point, when it's serious, yeah, you want to treat the downstream side effect or the downstream symptoms going on. But
Yeah.
throughout my entire life with managing my condition personally, I've been trying to reverse engineer my process to go a little bit deeper because, like you said, my thought process is, well, we never figured out what caused this in the first place. And like, could something continuing could be going on with me that still we're missing and we're just blanketing or trying to manage as best as possible? Are we missing something? And can I do better? And I realize I'm not going to turn my health into perfection tomorrow and grow my native kidneys back and totally regenerate myself. Maybe that would be awesome. But in the meantime, I'm at least going to do all I can to try to manage my health condition as much as possible. And so often in mainstream medicine, I'm met with a lot of resistance when I say, I want to be a really good patient. And it's so frustrating. Yeah, it's a frustrating thing. And again, it's because a lot of times they don't know or don't value. And that's just why I'm so glad that you guys exist. And all of this conversation is reminding me I need to make an appointment and get some labs and look a little bit deeper. And again, not to course correct my entire history, but hey, are there some things that maybe I could address that could help me do better? You
Yeah,
know?
I think that is such the perfect question, isn't it? It's like, and it's, you know, even with me with chronic disease, it's like, okay, well, I've looked at this and I've looked at that and I've looked at this and I've looked at that. And it's like, okay, what else can I do? So it's, you know, obviously the curiosity part that you and I have spoken about, and being curious and checking stuff, and you know, keep digging. You know, I haven't found, you know, I think mine's a conglomerate of, you know, lots of head traumas from riding horses and things like that, probably emotional stress as well. And you know, do we ever clear that out? Like, how do you ever really resolve and move deep trauma? I think I've done it, I've processed it, but is that just sitting somewhere deep inside my cellular matrix that, I don't know. My gut seems to be good and my tests are all come back normal, but you know, I think it's having that continual curiosity and, you know, looking at things like the integrative testing, if people can afford it. I get that that's not viable for everybody, or having at least, Lindsay and I spoke about this on a podcast. She said to me, I asked her, what do you think makes a good provider? And she said, they have to be curious. Because do you know how many times we'd have a patient like you, right? And if I was a provider and you come into my office, I go, wow, Stephanie has done really well. Like, I mean, look at her. She's a picture of health. She's a vibrant woman. What is she doing that maybe my other patients that are struggling haven't done? And be curious and ask questions. Well, I had a patient with a desmoid tumour, and a huge one. I think it got to 20 kilos. I don't think I'm making that up. It was huge. He had half his lung cut out, like, and they were like, you know, and it grew back. You're going to have to go on chemo, blah, blah, blah. And he said, well, that nearly killed me last time. I'm not doing that. And at least he's intuitive enough. And so he's like, I want to do this. And it was some peptides and all the stuff I'd given him. And they were like, well, you can't do that. It's going to kill you. You need to go on chemo. And he ignored them and did the protocol. And he went back, and his tumours in 3 months, really short amount of time, have halved in size. They've never done that before, even with chemo. So the doctor said, oh, you took the chemo. And he said, no, I did all the stuff you told me not to do. And do you know what they said? We don't need to know what that is, but keep going with what it is. Now, I was pissed, because as a provider who is treating other people with desmoid tumours, which potentially could kill you, wouldn't you say, I am super curious, tell me exactly what you did, this might benefit some of my other patients. But instead, because it's outside the field, I don't want to know about it, but it's worked for you, keep going. I was absolutely mind blown that that was the mindset and the attitude of a primary healthcare provider that does this day in, day out, that didn't get curious. I'm like,
I can affirm this has been a conversation I've had with multiple providers. And usually I don't go into my providers and say, like, well, look at me, you should study me because I'm doing so good. I don't say that. But I've
no,
had a lot of prestigious transplant providers and doctors that I've worked with, and they're like, you're like an anomaly. I'm like, aren't you curious why?
yeah,
And it's like a lot of times what I get is, and I've said this same thing that you just mentioned to a provider once. I said, I hate to break it to you. I said, but a lot of how I got here is by not listening to what you guys have told me. I'm like, I love you and you got a part. Like you're an important player in my
oh,
life.
sure.
I'm like, but I got to be honest with you. And again, it really sucks to feel like a pariah in the patient field, especially when I'm really doing good and I have a real desire to share what it is that I've done to continue to adapt to this kind of chronic illness transplant lifestyle. But the curiosity is not there, but what's even darker and what I've heard from nephrologists especially is the rhetoric of like, yeah, my patients just aren't as motivated as you. There's like almost like I've already given up on my patients attitude.
Yeah.
And that really sucks. That sucks even more. I mean, I actually was working on a peer mentorship program in New York very briefly, and I had a prestigious kidney coordinator say to me like, "You can't go into the dialysis clinics." Like, she actually swore and she said they're just too effed up. They're not gonna do anything. And I just was like, oh my God, help me. Like, if this is the attitude, if this is where you're at, like, number one, it's time for you to get another job. You're burnout. And
Mhm.
if don't get me wrong, kidney failure and dialysis and being in clinic is the hardest thing I've ever had to go through in my life. It's not a pretty environment. Yes, there can be good interactions and it's keeping you alive. I get that. But it's a really depressing environment. But when our providers have relegated themselves to like, yeah, like all of this great alchemical gold you want to bring back and share with patients and how you did this, like, it's not going to help because they're just not going to do it. Like, that's really dangerous behavior, I think.
I agree with you. I mean, I think we've talked about this before. My first neurologist that I ever saw, and I was up and healthy and, well, healthy, but, up and walking around and having a wonderful time and heaps of energy. He's like, oh, you'll be in a wheelchair in 5 years. And I fired him on the spot. I'm like, I'm not going back to see him. And it was interesting. My mum was with me, and it was when I was married, and she said, can she have children? And he said, well, do you want to bring children in the world with subset genetics, blah, 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 blah. Now, this man's sitting across the table sweating like a whatever, and I'm like, and I now know he had type 1 diabetes. And my mum said, do you have children? He said, yeah, I've got 5. He's a type 1 diabetic. His genes are no different to me, but, like the audacity to say that. And again, that no curiosity. And when I went back 5 years later and was still running around and having a wonderful time, there was, there's no, what did you do differently? And there was the whole, if you don't do what we tell you to do, this is what is going to happen to you. And, I'm the worst person to say that because I'm going to go and do the opposite of anyone that has that kind of attitude. But the bulk of, you and I are lucky. Number one, we're curious. Number two, we've got health training. And so we know there's different. You've seen it in patients. You know to question the narrative. The problem is that if you haven't had that curiosity and that natural propensity to challenge what doesn't feel internally right to you, you potentially, and I'm not saying all advice like you is incorrect, it's not, the medical system is established for a long time for a good reason, but, potentially some of these things aren't great for patients or they need a nuance. And if you don't question it, potentially, as you've mentioned earlier, people are missing out on healings, and that's a problem because of lack of
Yeah.
curiosity.
Yep. And this kind of leads us into our last question. And something that I've observed over a long period of time of being with all sorts of providers and in prestigious American institutions with high level surgeons and doctors is that sometimes And I have to say this, you know this, because we've done many presentations on the masculine and feminine energy and men and women and how we're different and relationships and all that kind of stuff. But a lot of times I see from the traditional kind of white haired American doctors, the guys who've been in the game a long time, is like, let's fight this. Let's go to war with this, like the traditional masculine attitude. Let's go to war with this. And then let's like forget it ever happened and just have fun again and get back to your life. It's actually a very naive way of integrating an illness experience. And I think that people who are more hypersensitive, more intuitive, embrace that right hemisphere of the brain, creatives, empaths, they need a different way of treating their illness. That's what I know to be true. And they tend to be, they want to be curious to create meaning and story around their day-to-day living with this illness. And the traditional system and model stifles the ability to grow and evolve with their illness because of this reductionistic mindset. And I think that's probably my biggest message that I try to share. It's not an easy one, but is that I believe from my history that there's something even before the onset of my disease that was going on. And I have a deep curiosity within my lifetime to cultivate a story around this mystery of what happened to me and what I have to live with on a day to day basis. And I've constantly been investigating without being obsessive of like, how do I cultivate this story? And the Western medical model has been my biggest barrier for integrating my illness experience in a healthy way. And my last question to you revolves around the mind body connection and stress. The role of chronic stress and the nervous system and exacerbating chronic illness is gaining a lot of attention, as we know. Uh, Collectively now, it's not just like a personal thing. It's like everybody's just assumed that we have stress and anxiety. And collectively, it almost seems like governmentally, culturally, they're just trying to infuse and inject more fear and stress into our environment and dysfunction and polarization. What integrative mind body techniques or technologies do you see as underutilized for people with chronic disease or CKD? And what keeps you up at night regarding their accessibility? And just in general, if you could just speak on how not just personally, but collectively and upstream stress can impact our illness. And before you answer, right before this, I was watching a podcast on a gentleman who talks about narcissism. And that's another thing that you and I have touched upon in different episodes is somehow now culturally we've got like the bully and the sensitive soul or the narcissist and the empath. And relationally, we're understanding that our environment, not just our biological environment, but our terrain and the people we spend time with and energy and frequencies and like all of a sudden we're waking up to, oh my gosh, do my relationships I'm having with my parents or my partner or my boss, is this making me sick? And there was a podcast, this guy, the effects of narcissism on our hormones that contribute to chronic disease. And I just was like, wow, this is so brilliant. So, this whole stress, mind body connection, not just being personalized, but now really collective, it's like we just can't get away from it. What are your suggestions?
Great question. I mean, I think you've answered a lot of that sort of stuff in there. And I'd be interested to kick it back to you to see what worked because you obviously, live in this field. I think for me, first off, from a biochemical point of view, we know that if you have excessive amounts of cortisol, which is the stress hormone, that cortisol is an immune suppressant. That's why people go on corticosteroids when they've got a lupus flare and MS flare. It suppresses the whole immune system. So that's the whole point. So if you're under chronic stress, you're going to chronically suppress your immune system, which means you're going to be more prone to things like parasite infections and more prone to, other sorts of infections like EBV or any of those types of viruses that we know can drive long-term inflammation and chronic disease. So there's no magic happening in the background there. There is a physiological response. We know that chronic stress increases cortisol, And then inflammation changes, the whole inflammatory pathway breaks behind. We've got T helper 1, T helper 2 cells. We get a break in that. Then you get in, even if you're producing a lot of cortisol, you can still get increases in other cytokines like interleukin 6 and tumor necrosis factor, and all these things that come together in our chronic inflammatory diseases, even with chronic stress going on there. Because what happens is when you have long-term chronic stress, the body will downregulate the cortisol receptors in all the cells. So every single cell in the body has a receptor site for cortisol. That's how important cortisol is. So if you expose yourself to stress for a long period of time, you downregulate cortisol and you become cortisol resistant, and then your body produces all these other cytokines and they upregulate and you get these chronic inflammatory diseases. So it's part of all of that. So that's the physiological part of it. And it's interesting, if you go back to, and we've got this whole mechanism designed because in primal times, if a saber-toothed tiger jumped out, you want to have this, what we call fight or flight response, and people know about sympathetic and parasympathetic. You want to be able to switch on that sympathetic nervous system super quick, so you're sending blood out to the peripheral, you've got less blood flow in the brain, and you've got your heart's pumping more, and you can do all of those things and burn energy and get away. But then you should be burning it off. And then just like if you watch a David Attenborough show, and then you've got these gazelles being chased by lions, and then when the chase is all over, they go back to grazing in the field. Now, how many people do you know when they get chased by a saber-toothed tiger, being debt, poor relationships, work stress, mortgages, 10 children that they can't afford to feed, cyclones, floods in Texas, all of those sort of things. How many people go back to grazing in the field? We don't, because we have no separation from chronic stress. We are in an environment that potentiates chronic stress all the time. So then the only way to get around that is we have to become very good at regulating our emotions. Candace Pert, the expert of the molecules of emotion and things like that, and looking at how emotions will modulate all of this sort of stuff. And, Joe Dispenza, for people that don't know, worked for him for years, and he made a really great comment, and I think he's right. We get addicted to the hormones of stress. We get used to feeling. And, I say this from a recovered workaholic, is I got so used to feeling, and I say it and I can still feel the neurochemistry in my body of getting up, how are you, busy, I've got stuff to do and running around, and that whole, we talked about it earlier about just taking a nap in the afternoon and doing things. There's no way I would have let that happen in the past because I was so addicted to getting my fix from being chronically stressed that it was normal for me. So I will say that detoxing from the hormones of stress is like coming off cocaine and heroin. It lights up the same parts of the brain. We get addicted to it. So I think the first thing is recognizing when we have an addiction to it and going, I have an addiction to being stressed. I'm maybe getting myself importance from it. I'm getting myself worth from it. It's the only way that I know how to function in the world. They were all the things that I had to get really honest with myself and go, wow, I'm breaking deep connections because I'm picking being stressed and drama over a regulated nervous system. So that was number one. That was a hard thing to face. Number two, to your point, we do become the 5 people that we hang around with. People say it all the time, but I'm like, you show me your top 5 friends and I can tell you who you are as a person, whether you're going to be motivated. You need someone in there that's above you, that inspires you to do better. You need people that are going to call you on your stuff, like a friend that will call you on your stuff and say, Fiona, you've been a dick about this, and da-da-da-da-da. Like, I have a person in my life that does that. I've got the person that keeps me humble, keeps my feet on the ground, my personal trainer. He's great at knocking the wind out of my sails because I'm always saying something stupid because it's early in the morning and I haven't had breakfast yet and I'm fasting and lifting heavy weights, and I'll say something stupid. I'm like, you wouldn't think I was training like 400 doctors yesterday, would you? And he's like, no. So he keeps me humble. And then I've got, people that I aspire to, my business coach, George, and his wife are, they keep me going that way. And then I've got just really good souls around me as well. But I have gotten in the last year very particular about who I let into my circle. And if someone isn't life-affirming, life-giving, or if they're drama, or if they take life energy, or they're really pessimistic, or, I had a friend just be like, they were like, well, you're always working so hard and doing this and that, and then you've got this lifestyle and you do all of this, and like just really negative about how I'm like, no, I don't need that. So I think that's the other thing, to your point, really looking at who you spend time with, because that is who your nervous system is. We've got mirror neurons. It's who we're regulating ourselves to. So that's super important. And then learning to regulate our emotions and doing that self-honesty thing. And so you're talking about what we can use. I mean, I'm a meditation girl, but I hung around Dr. Joe for a long time, and I wouldn't ever say I'm still good at meditation. I had some amazing effects, but it's a practice. I still do that every day. I'm big into vagal nerve tone and regulating the vagal nerve. There's so much information on that. Breathing, breathing. How many of us hold our breath because we're in that stress response? So 4-4-4 breathing or 4-7-8 breathing. They're free things that you can do. The vagal nerve stuff, I literally have a handout that I gave to both of my patients that I spoke to yesterday. Humming, gargling, om chanting, meditating, breathing. Free. They will all re-regulate the vagus nerve. If you're someone that likes gadgets and technology like I do, I've also got a Resemax, but pulsettos, any of those machines that vibrate on the vagus nerve. For some people that need the extra, kick,
Right.
they can be good. Making sure you get your sleep. Like I spent years waking up feeling like trash in the morning, thinking I'd had a good night's sleep, and I've got an Aura ring that tracks all my data, and I was getting no deep sleep. So I've spent a year fixing that, and now I get a beautiful amount. Like I'm so proud of my deep sleep, but it took me a while to get that, and that makes a big difference because I can cope better in the day. And then, I mean, I think you're naturally good at this. I wasn't. I've had to practice it. Just being really brutally honest with myself, self-reflective, and having people in my life that I allow, so not being self-righteous, that I will go to and say, I'm struggling with this. I need you to be honest, and trusting them that they'll do it in a way that's honest, but lovingly honest. And I've got 1 or 2 people that I do that with. I don't give that to everybody because not everybody is able to do it in a way. My sister's brilliant at it. In fact, she gets the gold star for that. It's my sister I will go to for that. I can say, what do you think about this? And she can be brutally honest, but in a way that is so loving that I have handed that over to her because I trust her implicitly to give that to me. There's really not anyone else I trust to be able to give me that insight that can deliver it in a way that I can hear it, that doesn't feel like self-criticism will set off my nervous system in another way. So, and then doing something about it, because once you have that information, if you don't do anything about it, then how are you going to change? So yeah, and so I think they're the things, but I think a lot of the stuff, and I'd love to hear your side of this because like I say, I feel like you're probably more naturally well versed in this, and this is what you've dedicated your life to with chronic disease. But I think brutal honesty, and then all the free stuff, meditation, and then that, changing your life around that sort of stuff, but then humming, like I make sure I sing every day. We know that and I know if I'm I'm doing well if I'm singing out loud. I've got a beautiful Doberman, and we know that connections, that dogs, I think they increase your lifespan by like 20 to 40%. So, I've got Popo over here, and also contributing to community. I think that's the other thing in this. It's very easy to become self-obsessive because I do think the narrative, and you mentioned it with the narcissists and the empaths, and I think with Instagram, the whole society has become very self-driven. And while I think that's still important, I also know from the studies, they've proven that when you give back to community and giving, which is part of why we do the podcasts, it's why you go in and do what you do. So I know you do all of this anyway, but I think when you become less selfish, there is so much that you get out of that, and sitting in gratitude practices and things like that. But when I really get a big kick, it's when I know I've done something really great for someone else and haven't expected anything in return, and the chemical dump that I get from doing that. So I guess it is in some ways selfish, but it's that when I do that, it's really connected and it's come from an inspired spot. There, for as far as what it feels to me like a flood of chemicals, endorphins, whatever it is that resets my whole immune system and being, that there's nothing that beats that. And that's why, when you're traveling around and doing all the stuff with Dr. Joe, that gets addictive in itself because you're doing that 24/7. So
Right.
So then it's got its other sets of issues where you start to give away your power to that. But, I think they're the things that I am mindful of. So definitely the people I hang out with, just the free practices, making sure my sleep's good, and being brutally self-reflective and self-honest, and having people around me that I allow hold me accountable, and then other people that lift me up, and, the good friends that do that. But
Yeah.
I'd like you to add to that because I feel like you've got some really great stuff to add.
Yeah, I mean, I went on a process of inner self-healing work, and a lot of it was my healing journey started out external. So it started out, what can I do outside of myself to contribute to healing inside of myself? And what happened was it just slowly got closer and closer to me, to the
Yeah.
point where I was like, oh, actually now my self-care looks like an inner process. I didn't really stop the meditation. I meditate, pray, eat, cook healthy food, go to the farmer's market. I try to be as connected to my local environment as possible. Um, and there are so many free tools. There are so many avenues people have to really work on themselves that are easy, effortless, free if they just commit to doing it and can pull away from the distractions of Netflix or their phone or social media or TikTok or whatever it is, and really give themselves that time. I think the one of the richest things that I've been working on lately for myself that's been really helpful is simplifying my life as much as possible.
Oh, I love that you said that. Me
Down
too. Mm.
Downsizing, simplifying, continuing to remove any grandiose thoughts I had about who I was going to be and what I was to accomplish, and not giving up on dreams and not giving up on progress on myself, but really just feeling mm, fulfilled, really fulfilled with where I'm at instead of this constant reaching towards some sort of achievement. It's more or less simplifying, being humble in the face of really my life, what I've experienced. My life's unconventional. My process was unconventional. So obviously there, if I compare, back to comparison, comparison can be used to motivate, but often comparison can be detrimental. And, you know, my entire 20s, I was like in a wheelchair fighting to survive. I didn't finish college and finish my degree the way I wanted and have a beautiful wedding and have all the, you know, I didn't go on the natural American dream trajectory that most people have the opportunity of doing. So my life has been very nonlinear. And therefore, sometimes when I look at people that have had a linear path and it appears to me like, oh, they must have it all now. They've got all the things in place, and but I've met too many of those people now to understand that actually I might actually embody something on the inside that actually maybe they're lacking. So, and I wouldn't want to exchange my inner self development and my spiritual connections that I have, and my awareness and, you know, kind of understanding of the psychology and how I've worked through my illness experience and where I've arrived to, with material gain. And yes, it's alluring, you know, to think, oh, I want to go on vacation, or I want a new car, I'm going to get a hat. Like, it is all alluring and it's fun. But at the end of the day, my process lately has been super finding humility in the face of everything that I've been, and understanding there's nothing material that can outweigh inner peace.
Perfectly. Yeah, that's
Yeah.
exactly right. And that it's interesting when I got into the personal development movement, it was all about finding your why and your cause. I spent a long time feeling like, I haven't found mine. And then I love Alan Watts and the whole Zen thing. They're like, the whole purpose, your purpose is to be alive. That's it. It's actually not more complicated than that. And when I really realized that and started living that, because I would say I've had suicidal ideations my whole life, and they went away overnight when I got that. When I realised, I'm like, I'm not here to do anything, and I can let go of this search, because this continual hole in me that felt like I wasn't quite doing what I needed to do. And when I reworded that into my only thing is to be alive, and what does being alive mean to me? Like, do I want to get to my deathbed and go, well, I managed to accumulate stuff, and I'm like, that's not being alive.
I got a Lambo.
I got a Lambo. My business partner Georgie Boy would be like, yeah, I got a Lambo, and that's good, but he loves his car, so do I. But like, what is living? And that's really it's been this year really, that's what drives me, is what is life force generating. And they are things that they're just deep conversations like this. It's about being able to look after my Doberman to the best possible way possible. It's about being able to sit outside in the sunshine and drink a nice healthy cup of tea and eat good pure, I'm looking at a consumer counter, like really good quality dark chocolate, and knowing that I, possibly put out information that people like, and that my garden looks beautiful, and that I get to go to the gym every day. Like, that is living for me. And when I do that, just those suicidal ideations, which I have had since I can remember, disappeared. First time ever. And I was like, wow, I just had to give up the hunt for having this purpose that always felt like I was left out of the club. And that has been the most liberating and empowering thing for me. And it also allowed me, and I know we've been talking for ages, but I'd love just to hear your point on this. It also was the thing that allowed me to rewrite the narrative around having a chronic disease and not being able to heal myself miraculously when my whole spinal cord grew back and things like that. It's like, maybe having MS is the vehicle to which I am enjoying all of these things more and doing that sort of stuff, because if I didn't have that, I'd probably still be looking for a purpose. And yeah, that it really, MS was for the first time, and a spinal cord injury because I got both. Probably the first time it made sense to me why that maybe had to be or is a part of my journey. And when I rewrote that narrative, I can feel gratitude for it, and it makes me a better person.
I love that. I can totally relate. I can totally relate. Simplifying, creating the story, experiencing. Again, it's just we live in this culture that doesn't value it. It values objective truth and progress and forward motion and action and doing, and it just doesn't value the nurturing aspect of that feminine, which is what about just living and the experience. Everything that Alan Watts says is all about that counterbalance to the traditional way that all of us have been taught is the right way. And we wonder why we're so sick, is because we live with half of our beingness being obliterated by people pushing the agenda and what's your purpose and what are you going to accomplish and how much money do you make and what do you do. And so yeah, I just I've realized that I'm a little bit different. I used to feel alone. I used to
Mm,
feel alone,
mm.
like I back in the day, like I don't belong on this planet kind of thing.
Yeah,
And there
100%.
was a lot of healing I had to do around that too. And realizing I belong here as much as anyone else belongs here, and I'm just being true to who I am. And that's another thing that's really important to me, this humility and simplifying my life and kind of removing the grandiosity, but also really valuing just the beauty of innocence. It's I have an addiction. My addiction is my head. And it's like, I love to learn and think, and I have this intellectual capacity, but very often if I don't monitor it, I can be in like a head-to-head battle a lot with myself and other people. So this realization that I like to think, but also remembering that, that thinking has to be partnered equally with my heart and experiencing and just being and just letting loose. And I haven't got to that place where I'm just like Alan Watts, just completely in beingness and really just being awesome at everything I say and just making fun of just how most people live their life so beautifully and eloquently. But that's been my journey, is to just you're good enough as you are, kid. Like, you've been through a lot, like you're killing it. Like,
Yeah,
and
you really are.
there's nothing about me in my entire life's journey that I know is going to all of a sudden start eating like crap or not caring about people or just give up. It's just I care too much. I deeply care, and that's probably a good thing. And it wasn't balanced, and probably one of the reasons why I ended up here, because I wasn't balanced. But when you pull yourself up and you look at the journey, I'm like, wow, all of my traumas and all of my hardships are what moved my marker in the right direction. It's like people say, you're not gonna change unless you're hit over the head by a 2x4, sadly. So I've been hit over the head by a couple of 2x4s, and they were really life changing. I try not to dwell on them. I find that some people get stuck on dwelling on the things. And some things have been really hard to integrate and get over, primarily like, difficult relationship breaks. Like they hang with you for a
Yeah,
while.
they do.
It's
They
hard
really do.
it's hard to move through it. But when you realize when it can be a part of your story, but not all of your story, and you can kind of see the greater picture and be like, wow, actually, all in all, like we have what we're doing here on this planet. And like, I think we're all doing actually pretty good. It just like softens the story a little bit and makes life fun and joyful again. And again, just like innocent, but not naively innocent. It's like,
Yeah,
no, I'm aware. I've
yeah.
learned. I'm pretty aware, but I don't need to constantly like intellectually prove my chops. Like I can just sit back and be myself and have fun and let loose and be simple and be radically imperfect and still be really happy.
Yeah, but yeah, you summed it up. I think that's a beautiful thing. And it's a hard spot to get to, like, especially with Instagram culture and things like that. It's why I sort of ban myself from social media and try not to read comments, even though I'm answering all the ones on YouTube. But yeah,
Yeah.
it can be hard. But I think everything that you said is right. And when you can stay in that, it's not like I'm in that all the time, but that's where my greatest joy comes from, is when I'm exactly in everything that you just mentioned.
That's right. Thank you so much. That's all the questions I had. And I learned so much tonight. So thank you so much.
Pleasure. Glad it was useful. I'm glad to hear that next time we'll be going back to our regularly scheduled program with Stephanie doing a beautiful presentation. I could just see
But
giving you
this
a
was
blank.
so great. I learned so much. So
Well,
great.
no, thank you for asking. I mean, it's funny being on this side because you ask questions, and because you've been through the journey, you ask questions that probably most people have. That number one, being in the field that I assume people know the answers to, or I forget people are curious about that stuff, or we haven't had guests on that have spoken about that. So no, thank you. I appreciate you
Yeah.
as always.
Thank you.
And I will say this, young lady, that having you and having these deep conversations has been part of my healing. I really value you and having someone
Mm.
that I resonate with, that has been through a similar journey, that's that same sort of authenticity and empathy, and really has similar-ish, we've been through a lot of stuff in a similar way. So, and just listening
Mhm.
to you and watching how you've navigated yourself and how you hold yourself and what you've been through, I think you're amazing. So thank you.
Oh, thank you. And thank you. And I am delighted to be connected with you. I mean, going through this without a functional or naturopathic doctor to help me in the beginning, I think was a huge, I missed the mark there. I was so sick, and the doctor said, like, no one else is going to help you. Nothing else is going to help you. Here's all the steroids, and here's what you have to do. And I just somehow surrendered over to the Western medical model. But in that, I really got the full picture of how deeply flawed it is and how we're so deeply missing the mark for so many patients.
Yeah, we all need to do better for sure. So, and
Yeah.
look, things are changing. They're heading in the right direction,
Yeah.
which is
Yeah. Quickly,
great.
too.
Yes, at the moment, very quickly. So, well, it's always been a pleasure. If anyone has resonated with everything that Stephanie said, I'll put a link in below. You can do some one-on-one coaching with her. She is our mindset and really facilitator. And I don't know, what word would you like to use? I'm missing the word here, but it's the client experience concierge kind of
Yeah,
thing. Of
sure. I think that's great. It's almost like a emotional spiritual guide to kind of walk with you to offer you another perspective when you get stuck in the mud.
Yeah, and especially if you're going through transplant and dialysis, because Stephanie has walked this journey numerous times herself. She really understands the depths of it, and I think it's really handy if you're in the depths to have someone who's been through it, who can empathise but can pull you out. So I'll leave all the details in there below if you'd like to connect with Stephanie. If you'd like to know more about what we do, make sure you head to www.kidneycoach.com. The new website is up and running. And make sure you hit like and subscribe. That is how we keep this channel going. And thank you for being part of our community. We really hope you found this valuable. If there's any other topics you'd like Stephanie and I to talk about, please put it in the comments below. And Stephanie will be back. And again, thank you. All right, everybody, we'll see you next time. Enjoy the rest of your day. Thanks, Stephanie. Bye.